Hey everyone, Dr. Luke Peterson here, physical therapist with a knee replacement therapist. In this episode of the Need to Know Show, I'm going to share with you a lot of the different things that are normal parts of the rehab and recovery process after surgery. So as I go through the social media groups, the Facebook group, other forms of social media, the comments, a lot of questions and comments, and probably the majority of them are along the lines of, I have such and such going on, or I'm experiencing this, or I'm feeling this, or this is going on. And then it's followed by the question of, is this normal? Or has anyone else been experiencing this? And there's a lot of different things out there, and I'm just going to share a bunch of them. Now, does this mean that these things don't need to be addressed and don't need to be worked on in physical therapy or with the doctor or with other means, or just through yourself and your self-management? Absolutely not. These things definitely, can be concerns and things that you have to work on, but at the end of the day, they're kind of the nature of the beast. There are normal things, prevalent things when it comes to rehab and recovery after knee replacement surgery. So let's just talk about some of them. First off, the big one, pain. Pain in the knee, pain on the side of the knee, pain in the back of the knee, pain in the front of the knee, pain into the calf, pain into your hamstrings, your front of your leg, pain in your hips, pain in your low back. It happens, it's prevalent. Your body is going through a significant change, it's moving differently, it's doing things differently. It's going to take some time to adjust. Along the same lines, swelling. Lots of swelling, stiffness, bruising early on after surgery, numbness, patches of numbness, fluctuating numbness, itchiness. These are all normal. These things can last a long time. Usually you'll have kind of episodes of increased intensity of these different symptoms, and then times where these symptoms are calmed down. It's really normal to have these ups and downs. Recovery is not going to be this straight path. You're going to have these times where you feel great, times where you feel a bunch of these symptoms, times where you feel great, and it's going to alter and change throughout the recovery process. That's perfectly normal. What else is normal? Well, just having a weird feeling of the new knee. The new knee feels weird. It feels foreign. It feels different, strange. Some people say it feels cold. I can feel the coldness of the metal. This, again, perfectly normal thing to experience. Almost everyone at some point in their recovery is just going to have that feeling of, this is something foreign. It's not my normal knee, and that's perfectly okay. Noises. Noises are very common, very normal. If it's not accompanied by a sharp increase in pain, it's probably okay. And it will probably, for most folks, kind of subside and diminish over time. Some people have a little bit lingering noises that kind of remains for a long time after surgery. Some other things, talking about mental health, emotional health, things that are very prevalent after surgery. Depression, anxiety, feeling of loneliness, hopelessness, feelings of anger and frustration, possibly regret. These are all normal parts, normal things to experience. You're not a failure. You're not doing anything wrong. You didn't miss something. It's very prevalent, very normal to experience these things after surgery. Now, for the vast majority of people, not necessarily everyone, unfortunately, but the vast majority of people, things will improve. These symptoms will diminish. You'll get better physically, you'll get stronger, you'll get more mobility, you'll be able to walk and tolerate activities more and more as you recover. And as that happens, a lot of those mental and emotional things will hopefully start to improve as well. You'll feel more confident, you'll feel more involved in activities, in your normal daily activities, and everything overall improves. There's probably the vast majority of people, when you ask them if they had the option to go back and have a knee replacement surgery again, the majority of people would say that they absolutely would. So even with all these things that are part of the rehab and part of the recovery, all these things that are really tough and a real struggle, for the vast majority of people, not everyone, but most people are happy that they had a knee replacement surgery in the long run, in the end of the day. Just remember, it's a marathon, it's not a sprint. You have to have patience, allow your body to heal, allow your body to recover. You can get through this. You're all knee replacement warriors. Thank you very much for watching this video. Be sure to hit that subscribe button if you're interested in all things related to knee replacement surgery, exercises, rehab and recovery, everything else in between. And be sure to leave your comments and questions below. I'll do my best to get back to you. Thank you for watching.